And so what we're trying to do, and I have a couple of slides that I wanted to show, what we're trying to do is make sure we take on that position of educating the patient, because if it's going to be complicated for clinicians, how is it going to work for a patient who's going to be first diagnosed, and then you have to decide on what your treatment options are? So can I have those slides? Thank you. Now, next slide. When that patient receives that diagnosis and hears you have prostate cancer, this image is everything that the patient feels. They feel lost, confused, unsure, unclear, perplexed, disoriented, bewildered. What are they going to do? Next slide. And we recognize this. And that's why we created PHENpath.com. So when you get that diagnosis that you have prostate cancer and you don't know what to do, we can use a tool, PHENpath.com. Again, it can be on your phone, your tablet, your laptop, your desktop computers. It's not an app that you need to download. Next slide. So if you go to PHENpath.com and take a look at this portal. This portal, again, as we had mentioned before, we use very aggressive guidelines. We use the guidelines that are created by the National Comprehensive Cancer Network, the clinical treatment guidelines for their doctors. And this is in the palm of your hand. So when you're sitting with your doctor and they're talking about all these treatment options, you have a tool that you can go to. Next slide. Now, I always go back because, as I mentioned before, Tom has a message. And each tool, there's a message for each tool, and really reflects his journey along his 21 years survivorship. And he's saying here, he's a 21-year survivor, and he has experienced enormous challenges of identifying treatment pathways and the most appropriate treatment pathway for himself. Tom personally designed PHENpath to support the needs of all prostate cancer patients as they travel along their personal journeys. And this is why and how it was created. Next slide. So it's a very easy portal. And as you mentioned before, we try to group it according to areas of diagnosis. So the PHENpath can be divided into a segment: initial prostate cancer diagnosis, those people who were just recently diagnosed, versus the survivors who have recurrent disease, whether it's PSA recurrence after surgery, after cancer progression after radiation, advanced hormone sensitive cancer, and castration resistant cancer. So in each one of these, you have the ability to go in and look at those trials that are those treatments that are specific for your diagnostic stage. And again, we also let people recognize that clinical trials are part of your treatment options. Next slide. And what I mentioned before, and what you've heard in the previous lecture, that's a complicated cocktail of mixtures and treatment options and wood therapy, immunotherapy, radiotherapy, surgery. What is it? What will a patient do? And in the past, clinicians would make the diagnosis and treat and give the treatment recommendations. But with PHENpath.com, we are able to, with the patient, work at having an informed shared decision-making process. That means the doctor gives a recommendation, the patient has the knowledge, and now there's more value and preferences or play a role in the decision-making process. And at the end of the day, hopefully the patient is more comfortable, more understanding of their treatment options than feeling left out and also possibly having regrets. So now what I want to do is I want to bring on a few gentlemen.